Hello, friends. Hello, everyone. Hello, friends. Welcome to YouTube channel Health Q, the place where our mission is to motivate you to look at the brighter side of the health. And as you guys know, we have been constantly connecting with you and telling you that we would be coming live and we would be interacting with you guys. That we would be talking more about back pain, back care rehabilitation. And yes, that life, that long awaited life is now here. So we'll wait for some time for people to join in and then we will start our live conversation. Hi Vivek, thank you for joining. Just 2 minutes, our guest would be live online. Yes, you can just go to your profile, tap over this. Okay. Yeah, there. No, you need to close and join again. One. Close that. Yeah, close the app and join again. Yes, you can show. Now you can ask for the joining. Yes. No, you close it. That message is there, no? No. That message request to join. That one. All right, friend. Thank you so much for joining live. And now we have our guest with us. So I would be adding her in our session. Okay, friends, thank you so much. So let me first introduce Priya. Hi, Priya. Welcome to Healthcare Rehab channel. So we both have collaborated today so that we can connect with you guys and talk to you about back pain rehabilitation. So back pain is one such common problem that almost every one of us experiences. Hence, we thought that we should do more and more informative videos on that. And physiotherapy alone definitely is one thing that helps, but it becomes much more better when yoga therapy is added to that. So today we have this yoga therapy expert with us who would be helping you all and will be informing you how yoga therapy can help you out to manage your low back pain issue. Good afternoon, everyone from YouTube as well. So we have some people who have joined. Dr. Fizan Khan Physio is there. Saurabh Kumar is there. Good afternoon, sir. Thank you so much for joining this session. We would be taking your questions, but before that, before all the questions we take, we will give you a brief understanding about the back pain issues. So feel free to put all your questions related to back pain or else anything that you would like to ask about therapeutic yoga or else yoga therapy in the comment section so that at the end of the session, I would be able to read out those questions for our guest and she would be able to help you out and answer them. So thank you again, Priya, for joining in the session. So yeah, tell me, can you just let us know about your background and what you have done in yoga therapy till date?
Yes. So good afternoon, everyone. My name is Priya Nair. I used to be a software engineer in my previous life. I've been practicing yoga for 15 years, and for the past 4 years, I've been a yoga teacher, a yoga therapist, as well as a prenatal yoga teacher. Okay, and today we are going to talk about the therapeutic aspect of yoga, especially for back pain. And we'll be first doing a brief introduction to yoga therapy, and then move on to details.
Right. Thank you. So, Priya, just tell me what is the difference, the core difference between yoga therapy as well as a regular yoga session that people go for? What's the difference between that?
Okay, so good question. A lot of people ask me or rather don't know that yoga and yoga therapy are two completely different things. Okay, so traditionally now yoga is a very ancient science. Okay, it's 5,000 years old. And according to traditional yoga, yoga is done only by people who are healthy. Okay, contrary to what we do now, only healthy people are supposed to do yoga. Okay, first fix yourself, then do yoga. Uh, so this is a 5,000-year-old science, and what people obviously notice is the more you did yoga, and if you had any problems, it started making you feel better. You could overcome the problem, get cured completely. So yoga therapy came about. Okay, it's around very recent, around 80 years back. Researches were done, and yoga therapy is now specifically catered to a condition. Okay, so main difference between yoga and yoga therapy is if you go to a yoga class, you will tell your yoga teacher, I have this problem, I have that problem. The teacher will do a general assessment, give you a class plan or do the regular yoga class, keeping your limitation in mind. So if you have a BP problem, they will tell you those who have BP don't do this, right? So it will take care of your limitation, but you will be doing a general practice. In a yoga therapy class, you are targeting your postures, all the practices for your condition. So the main intention in a yoga class is for general wellness. The main intention in a yoga therapy class will be to manage your condition, to possibly cure your condition. Another difference is yoga class you may have the asanas, pranayamas, maybe a little bit of meditation, but yoga therapy will have many more things. You will have chanting, you will have meditations, cleansing practices. So yoga therapy is much more than just asanas and pranayamas.
Right. So, Priya, also being a physiotherapist, I guess any physiotherapist gets maximum number of patients who suffer from back pain. Now, why a person who suffers from a back pain should take yoga therapy as well as physiotherapy? Like, what makes yoga therapy different from a regular physiotherapy for back pain, which is done?
Very good question. Just by the name itself, physiotherapy, okay, it is for your physical body, correct? So you have physiotherapy is for musculoskeletal issues, neuromuscular, anything that is related to the physical body. Now, in yoga, we believe that we are made up of 5 bodies. Okay, it's a very little bit deep concept. We won't go into details, but we have a physical body. The next layer is a breath body. The next layer is a mind body. Because as we all know, any physical problem originates in the mind. Okay, so we all are made up of different layers. And in yoga therapy, you are also dealing with your spiritual, your mental, your breath, your physical, the gross body, right? So yoga therapy is holistic, dealing with each and every part. So all the 5 bodies we deal with, not only with the physical body.
And so, as you said, that yoga therapy deals with physical as well as your mental aspect. Now, definitely, when a person suffers from back pain, it's not just a physical problem. It somewhere affects your mental health as well because you are suffering from pain, and that neuroplasticity starts working, and there is a back memory that is coming, and it affects your overall well-being. How much yoga therapy can help a person to recover from that back injury? And how much is the efficacy, you can say, that says that okay, yoga therapy when combined with physiotherapy can help in a longer run for a patient suffering from back pain to recover?
Okay. So in yoga, spine is the main epicenter. Okay, spine is called Meru Danda in yoga. In Sanskrit, Meru is mountain, Danda means stick. Okay, so everything in yoga is actually revolved around the spine because spine is the second brain. You all know all the nerves run along the spinal cord, and any misalignments in your spine will start leading to problems. Now, in our daily life, we hold a lot of tension here in our neck and shoulders. We hold a lot of tension in the thoracic spine because of which we don't breathe well. We hold a lot of stress in the lower back because you're sitting for long hours working on our laptops. So when you combine yoga practices, of course, apart from asanas, because we do all the spinal movements in yoga, so that is one main thing. Your muscles, your ligaments are all very supple and flexible. In normal life, you're only forward bending. You're on your laptop, you're on your phone, you're bending down to pick up things. But when you do yoga, you're doing back bends, you're doing twisting, you're doing side bends. So you're making sure that all the spinal movements are covered in yoga. Okay, that is number one. Secondly, breathing. Because we don't breathe well in yoga, we say your prana in your body becomes less. Okay, the energy flows in your body become blocked. So when you're doing pranayama practices, you're actually, and in terms of Western medicine, you breathe well, oxygen is reaching each and every cell of your body, right? So when you're doing breathing practices combined with physiotherapy, with asanas, you're actually improving the efficiency of each and every cell of your body. Apart from that, you're doing meditation, you're doing yoga nidra, chanting, just to calm your mind. Because most of our problems are because we are stressed. We are always running from one thing to the other. If you just take 10-15 minutes in a day to just remain still, to breathe well, to still our mind, we are going to have tremendous relaxation for our body as well as the mind.
Quickly, guys, I would like to also tell you in middle of the session, please feel free to put your questions in the comment section box. At the end of the session, we would definitely try to answer all the questions that you guys have asked. So please be patient, stay till the end of the session so that we can answer your questions. All right, so that takes me to the next question. That when it comes to back pain is a very broad term. There are many reasons why people suffer from back pain. So, what are the different back-related issues where yoga therapy can actually help a patient tremendously?
So as you said, Meghna, a lot of reasons that someone may have back pain. Okay, now the main reason in our current lifestyle, there are three main reasons. Okay, one is misuse of a spine. Misuse means what? You're lifting weights wrongly,
Right.
you bend down, jerky movements.
Right.
Okay, bad posture of sitting, bad sleeping posture. So you're misusing your spine.
Got it.
Disuse of a spine means you're not using your spine enough. Okay, always one movement is happening, no other movements are happening, because of which the other supporting muscles start becoming weaker and it's a lot of pressure on your lower back.
Right.
And overuse of the spine, which means certain professions need to stand a lot, certain professions you're squatting a lot, or you're running and not doing enough of stretching and strengthening. So you have overused your spine. So all the problems that are related to misuse, disuse, overuse can be, you can go to a regular yoga class, do regular stretching, strengthening, at least include 2 to 3 days of a yoga practice along with all other exercises. Okay. Now, when you have ignored these problems, and also another very important thing, you feel you're doing 1 hour of yoga or you're doing 1 hour of exercise every day. Okay, but you go back 23 hours of the day, you are not taking care of the spine. You're sitting in a bad posture. You're ergonomically not in a good setting. You sleep in a bad posture. So even if you do that 1 hour of exercise and yoga, the 23 hours what you're doing is also going to cause a problem. So you have to be aware whole day of you're sitting for 2 hours, get up, stretch, walk for some time, come back. So start getting aware. So yoga and yoga therapy help with awareness of your body. The minute you start feeling something stiff, start moving a little bit, stretch a little bit. Okay. Now there are other conditions like slip disc, sciatica, other problems which are a little more chronic in nature. I will give you a disclaimer over here. When you have these problems, first of all, get a proper diagnosis. And before you do a regular yoga class, you have to tell your yoga teacher that this is my problem. Because once you have reached this level of disc bulge, disc herniation, sciatica, piriformis syndrome, and if you go to a regular yoga class, very high chances of aggravating the problem. So that is where yoga therapy comes in. Okay, you do yoga therapy sessions for some time. Get your back fixed a little bit, strengthen your back, stretch the muscles around the core, and then you can explore going to a regular yoga class. So this is where the difference between yoga and yoga therapy. That you have to know when you should go for yoga classes. When you're weak and you need to strengthen, yoga classes are fine. But when you have reached a condition like a sciatic, like a lumbar herniation, then you must go for yoga therapy and avoid going to a regular group yoga class.
All right. So we are getting this feedback on Instagram that people are finding our voice echoing. So I'll just reduce the volume and just let us know is the echo reduced. Can you just make your volume lower your volume completely? All right, guys. So is the volume better now? Is the echoing gone or it's still the same?
Okay, now?
Now the echoing is reduced. Yeah, maybe it's because of that. Okay. I hope thing is resolved and it's feeling better. Perfect. We have gotten a better comment. Okay, fine. So we will continue from that, Priya. So my next question would be that what is the difference again? Like what kind of yoga a person should do when he or she is suffering from back pain?
Okay. Now, this totally depends on the condition, okay, and the severity of the condition. So, when you first go to a yoga therapist, the yoga therapist will do a detailed assessment. You have to have your reports because most people come to a therapist only when the problem has become chronic in nature. Okay, you have back pain, we ignore it. Then we start doing self therapies. And then only when we really cannot bear the pain anymore, we start going to a therapist. First, we go to a doctor and start to work on it, right? So depending on the severity of the condition, you have to again decide what practices have to be done. We'll be covering at the end of the session some postures which you can do. But before you do anything, you have to really know what the problem is. Because if you have a lower back pain due to, suppose, sciatica, completely different practices from when you have another problem, okay, like a slip disc. Different practices have to be done.
Right. Makes sense. Okay. And what should be the ideal duration? How long a patient should do yoga therapy in order to get or observe results?
Okay. So just like a physiotherapy sessions, when you first go to a yoga therapist, a lot of detailed assessments will be done, postural assessment will be done based on the client's availability, timing, based on the severity of the condition. In yoga therapy, we also have levels. Okay, level 1, level 2, level 3. The yoga therapist will decide which level you are at. Level 1 is a very basic level where the pain is very high, range of motion is very limited, and the postures and the practices that you can do very few. So you start at level 1 if you are at that severity. If you are somewhere in the middle, they will put you at level 2, level 3. So based on which level you are at and how bad the condition is, you may need to do a few weeks to a few months. And then, just like physiotherapy, you are done with your session and you can start doing on your own, or you can start doing for a regular yoga class.
Right. That brings me to the next question. How much level of supervision is required when it comes to yoga therapy? Can patient start doing it on its own, or there is a need of an expert to be there to help the patient to do their sessions?
Initially, it is very important to have a trained therapist, okay? Because there are 2, 3 kinds of people. Some people who have done yoga before, so they know the asanas, but they don't know at what level or what is it. You may be very flexible at that time. You may be able to do the posture very well, but a yoga therapist seeing your condition will tell you this is the level you should not go beyond because it's going to further aggravate the condition. Okay? Then there are some people who have never done yoga at all in their life. So they have no clue what asana, how to do, where you should be feeling, whether you should feel pain or you should not feel pain. So definitely, when you start, at least 6 to 8 sessions you must do with the therapist. And once, depending again on how comfortable you are, you can slowly start weaning off and doing it alone at home. And another thing I would like to mention, not only asanas, right? There's pranayama, there's mudras, there are cleansing practices. All these require supervision in the beginning, and only when you're ready to go on your own, the therapist will say that these practices now you can do on your own.
Perfect. All right. So, what is an ideal duration or is ideal time? For example, if a patient comes to you and complains of a mechanical strain or is a lumbar strain, right, which requires yoga therapy for certain days, what would be an average time for that patient to observe results? If it is a minor case, let not take it as a more serious chronic condition, but an acute pain kind of thing. So, how long it will take?
See, this is again totally dependent on the condition, but I'll tell you one thing. You have come to a physiotherapist or a yoga therapist after a few months of this condition. Okay, you have reached, you have ignored, or you have been trying, but it has not worked for a few months. So, as a general rule of thumb, it has taken you 3 to 6 months to reach this place. Give yourself 3 to 6 months to recover. Okay, that being said, if you are very consistent, you are aware of your body, you are taking the required measures, you are strengthening, you are doing all the practices as you are supposed to do, you can start seeing results as early as a week, 2 weeks. Minor baby steps, you will see results, and if you're consistent, very quickly your body will start to respond to the practices.
And what should be the frequency of this yoga practice? How often they should go for yoga?
See, I would say that since spine, like I said, is the most important, right? So you don't need to do it for half an hour or 1 hour. The spine strengthening and stretching, if you can just do every day, take 5 to 10 minutes of your day to just work on spinal movements to strengthen your back. We work on strengthening arms, we do legs today, we do core and abs today, right? But we don't really spend time on our spine. So every day, if you're spending 10 to 20 minutes just stretching and strengthening the spine, you will never have any back problem. And accompanied, if you do breathing practices and meditation, so keep, I would say, 15 to 30 minutes a day. Even if you're not doing a yoga class, keep it for spine stretching, strengthening. Keep it for a little bit of breath work, and you are set. Your spine will be straight as ever till you're 90 years
old. Perfect. Nice. So yeah, that makes me to the next question, which is like, when should we stop therapy? What is the right time to stop therapy? Are there any contraindication, red flag signs which says that okay, this is the time where we need to stop therapy and we need to take some serious medical measures as well?
See, first of all, before you we start the therapist will ask you for reports and for official diagnosis. Okay, because yoga therapists are not doctors, so you will need to give, maybe it could be X-rays, it could be MRI. So we will need to see all of that. Okay, any practice that we do, you should not feel pain at all. Any movement that you're doing, if there's pain, means you have gone too far. Okay, you have to always stay within the limit of pain. So the aim is not to reach 100% of your flexibility. You have to reach 30%, it may be 40% where you start feeling pain. You cannot lift your hands so much. So much you lift up your hands, starts paining, your shoulders starts paining. So you stay below the pain point. Okay, so like that, so you can continue yoga therapy without any problem. If you are not overextending, if you are not stretching, you can continue yoga therapy. If you feel sharp shooting pain, if you feel that after a few weeks or few sessions, absolutely no change, that is normal. But if you feel you have degenerated further, then maybe it's time to stop and reevaluate and see that maybe again consult the doctor to see what is really happening.
So, according to you, Priya, what are the best asanas that you would like to recommend, or else you would like to say that okay, these are the best asanas that a patient with suffering from low back pain can do?
Okay. Uh, so today, because we're talking about lower back pain, I will give a general. I'll give you a few asana names. They can be done by anyone. Okay, those who have pain, those who don't have pain, to avoid pain in the future. Okay, I would suggest that most of us, because we all are on the laptops, most of us are on laptops all day, so we all have very tight and short muscles of the core. Okay, now our spine is supported by the mid section of the body, which means not only core is not only the abs, core is the sides, and core are the back muscles. So when you are working with your spine, you're going to work on all these muscles around the mid center of the body, which gives a good support. If your muscles are strong, the lumbar area, the top area, we have the rib cage, right? It's supporting the vertebrae. But in the bottom, you don't have any support. Muscular support is what you have. So strengthening the core and the back and the side muscles are very important. So the asanas that I tell you, please note it down. You can do every day without pain, like I mentioned, and do 5 to 10 times counts, 5 to 10 counts of these asanas. So I would first suggest that you start in supine. You're lying down on your back. Okay. First asana, which is excellent, to start stretching your back. First, you have to stretch, right? Because muscles are stiff and tight. First, you start stretching, and then we'll start strengthening. So when you lie down on your back, first best asana for you is Pavan Muktasana. Everyone knows about this asana. Pavan Muktasana excellent for lower back pain. So you can either do one leg at a time, hug one leg at a time, or both knees to chest. So that is an excellent asana to start with. Next asana, Setu Bandhasana. Okay, bridge pose. Now bridge pose is you can do dynamic. Two ways you should do. First you start with dynamic, lift your hip up, drop the hip down, lift your hip up and down. So do this 5 times. And then in the 6th time, you lift the hip up and you hold. When you're holding, you're using and engaging your back muscles, your core muscles, your glutes to strengthen. So when you're holding, you're strengthening. When you're doing dynamically, you're stretching. So second pose is Setu Bandhasana, excellent for the lower back. Third pose is supine twisting. Okay, again you can do one leg or both legs. So hug one knee to chest, move the knee to the opposite side, or hug both knees to chest, knees to one side, twist, hold for 5 breaths, twist to the other side, hold for 5 breaths. Okay, so third asana is a supine twist. Another very good asana in lying down position is pigeon pose. It's called reclined pigeon. Okay, you can check it out. You can go online. It's called Supta Kapotasana or reclined pigeon pose. Very good for glutes. So your glutes, if are very tight, it will result in lower back pain. So Supta Kapotasana. So 4 asanas in lying down: Pavan Muktasana, Setu Bandhasana, supine twisting, and Supta Kapotasana. Then I'll tell you some postures in prone position. You're lying down on your stomach. Very good for upper back and lower back. One is very easy, Sphinx pose. Okay, Sphinx pose, you're on your forearms and you're lifting up your head and chest. Excellent. So people who are very, very stiff back, don't start doing Bhujangasana or upward facing dog. Start with Sphinx pose. start working on your upper back muscles. This is for upper back. So swings pose is a very, very basic asana. Second asana is bhujangasana, which is cobra pose. Now in cobra pose, just be aware of one thing, no jerky movements, and don't use your hands too much. So you are holding your hands down, but use your back muscles to lift up to a cobra. Another thing to remember in cobra, most of our shoulders are like this, just stiff in our shoulders. Keep your shoulders relaxed as you lift your chest up. So you're engaging more of your back. You're not using your shoulder, not using your hand, very important. So second asana is cobra or bhujangasana. Very, very good asana for lower back is shalabhasana, which is for your lower back. So your upper body stays on the floor and you lift one leg, you lift the other leg. All these exercises are very similar to physio exercises. Shalabhasana is super for your lower back. Those who have chronic lower back pain, don't lift both legs at one time. Do one leg at a time.
Right.
So when you lift up and down, do 5 times dynamically. Next 6 times, hold it up. Hold it for 1 count, 2 counts, 5 counts, 10 counts. Slowly, slowly start building strength in your lower back, in your buttocks, in your glute muscles. Okay, so in prone position, excellent is Sphinx pose, Cobra pose, Shalabhasana, Makarasana, just lying down is also very good. Then come on to your fours, okay, on your knees and your palms. Cat and cow, arch your back, round your back. So you're getting a good arching and rounding, very good for back pain. You will feel very, very relaxed. You can start lifting one hand, one leg. Different variations can be done. Child's pose is very good. Okay? Child's balasana, excellent for lower back stretching. Another asana, downward facing dog. Okay, you're coming to almost like a mountain. You're on your palm. Lift your hip and make sure that your spine is lengthened nicely. Okay, downward facing dog. And last two asanas in standing and taking. Tadasana. Stretch your hand up. Lengthen the spine. Okay? Because all the time the spine is compressed and the lower back vertebrae are all compressed because we are sitting for long hours. So stretch in Tadasana. Reach up and let all the vertebrae get space, right? Tadasana and Tiryat Tadasana. You can bend to one side, bend to the other side, hold for 5 counts on each side. So you're getting, if you see all the spinal movements, side bend. Okay. Another very important thing, if you have lower back pain, you're going to avoid forward bends completely, deep forward bends. No forward bends allowed. If you're bending forward, you will never go below hip line. So if you're folding forward, this is it, L shape. The head should never come below the hip. Head should always stay in line with the hip when you have lower back pain because it will aggravate your problem. Okay. So we'll be putting this list when this video comes up. So don't worry if you have not noted it down.
Perfect. So I would like to add one thing here, Priya. Like mostly, many people say that all these videos are available on YouTube. Why not to watch these asanas and do by yourself? See, when it comes to therapy or therapeutic situation where the things are not in general perspective or preventive perspective we are doing, exercise can be similar in yoga therapy or else in physiotherapy. What matters is the timing. At what stage, at what situation the patient is in, and according to that situation, that condition, that pathology that exists in the patient, depending on that, the real expertise lies there, where the therapist, be it physiotherapist or yoga therapist, come up to the decision that this is the asana that would be the best asana for this patient at this point in time. So even though we give the topics or as the name of the asanas, it's not necessary that every patient will find it helpful. It totally depends on the situation of that particular patient. Hence, it's highly advisable that if you are suffering from back pain and if you want to consider this combination method where we combine physiotherapy and yoga therapy and you recover from your back pain in a longer term, you should take help of an expert or as a professional who knows this place well, and then should be able to craft an exercise program which is customized for your situation. Right, that will give you the right results. Otherwise, you will not get result, and you will think that this didn't work, and then the story ends there. So, yeah, that is one thing that I would like to add. So, yeah, that takes me to the next question, Priya. Like, according to you, yoga is definitely a very important thing. But apart from that, yoga asanas, what are the other practices that a person should do on a regular basis to recover from back pain?
So, like I mentioned in the beginning, yoga therapy is not only for the physical body. Okay, asanas are mainly for the physical body. So, I will give you a few examples of people who are having lower back pain, what other yoga practices you can do to help with your lower back pain. Okay, so pranayam, everyone knows, most important again for us in this modern lifestyle. I think pranayam will help us more. I should not say more, but it should help us a lot to get rid of all our aches and pains. Okay, so the two best pranayams for people with lower back pain, which have no side effects at all. Okay, I'll first discuss them. Anulom Vilom, alternate nostril breathing, right? Anulom Vilom is excellent for any condition. You may be old, you may be young, you may have deadly disease, you have nothing. So Anulom Vilom is excellent. Why? In yoga, there is a concept of prana. Okay, prana means energy flowing through the body. Now we believe in yoga that whenever the prana is blocked or energy is blocked, that is where the problem begins. So if you have a heart problem, it's because the prana in that area of the body is less. So you're having heart issues. If you're having pain, it's because prana is not reaching. That is a concept in yoga. Okay. So when you're doing anulom vilom or you're doing any pranayam practices, you're actually increasing prana in the body. If you consider Western medicine, same concept. Oxygen is reaching each and every cell. Each and every cell is getting nourished. So you're definitely helping in healing. So Anulom Vilom is excellent. Deep breathing. Deep breathing means when you breathe in, stomach and chest should go up. Fill your lungs. When you breathe out, stomach and chest goes in. Very simple. Okay, sit in one place, deep breathing. And what will help even more in deep breathing is double the exhalation. So if you're breathing in 1, 2, 4, breathe out 1, 2, 3, 4, 5, 6, 7, 8. So double the exhalation. Very, very good for stress relief and it promotes deep physical as well as mental relaxation. Okay, so these two pranayam practices are very good. Uh, Other two pranayam practices that I'll tell is specifically for joint issues, but they have contraindications. People with heart issue, high BP, those who are menstruating will not do this practice. So Bhastrika pranayam and right nostril breathing. It's called Surya Vedana. So Bhastrika and right nostril breathing are also very good for people with any kind of arthritis, any kind of joint pains. But take care of these contraindications. Other practices that are helpful is yoga nidra. Okay, nowadays it's very popular. People are not getting sleep. All the time there is tension here, all the time there's tension in your body. If you do a 20-minute or 25-minute relaxation yoga nidra twice or thrice in a week, you will see that your muscles around these tensed areas start to relax automatically. Half your pain is gone there. Okay, meditations mainly for the mind because when your mind is tensed, your body is tensed. So meditations 5 to 10 minutes. Don't do every day if you can't do. Just sit still in one place 3 days a week, 2 days a week. Take time out for all these things. Keep priority. Okay, so these are the practices. Cleansing practices are also there, but that has to be done under the supervision of a trained therapist. Another very important part of yoga therapy is mudra. Okay, mudras are gestures. So I'll show you one mudra which is very good for the spine. It's a hand gesture. This is called Merudanda mudra. Okay, Merudanda is the spine in yoga. Okay, this is the cervical spine. This is the lumbar spine. So it follows the arch of your back, right? You're going to hold both the hands in Merudanda Mudra and sit in any posture. You may be on a chair, you may be cross-legged. Place them on your knees like this. Place them on your relax, not holding any tension. Relax completely. Close your eyes and just sit for 10 minutes. Sit for 10 minutes. You can do your count your breath. Try to keep your mind completely still. Your mind will wander away. Bring it back. But hold this hand gesture. Okay, why mudras are helpful in yoga? Mudras are certain circuits that you are complete, like electrical circuit. When you do certain movements, you are activating certain circuits in the body. So Merudan mudra is very good to help with back pain and strengthen the spine. So there are a lot of therapies like this. If you believe in it and if you are consistent, you can get rid of most of the problems.
Correct. So I think the key takeaway that would be from this entire session would be is it's ideal to understand the situation of a patient to see what is going through inside the body to understand with the help of examination, diagnosis, your test, taking proper examination from your medical doctor. And once that clear picture is there, that okay, this is the reason why the back pain is existing, depending on that, creating an exercise program, which should not just for a temporary relief, because temporary relief is not a complete solution. It's a partial solution. You will be out of your problem for some time, but then it will come back again. If you really want to get rid of back pain or any kind of ailment, it is always those small consistent practices that you do throughout the life or throughout a consistent period of time. that will give result. So I think my questions are done with this, Priya. Thank you so much. But yes, there are so many questions that we have got on YouTube live, so we will take them one by one. Yes.
Before we
Yes.
start with the questions, I'll just like to end with certain tips and tricks. Okay, very simple. Everyone already knows this. Okay, sleep well. Get your good rest because the body starts to heal only in your sleep. Okay, most of us are watching Netflix and YouTube and other things late at night. Have a routine, sleep well, and you will see that half your problems will not exist. Okay, hydrate well, have a lot of water, lift right. So if you are doing heavy weights, you're picking up heavy objects, be aware of your body. Okay, lift heavy weights right. Then I would say stretch and strengthen. Focus on stretching every day because we don't use most of the body parts, and just like any other machine, body will start to rust and start getting slower and slower. So every day, take time out to stretch and strengthen your weak, your back muscles. Maintain a healthy weight. Okay. So obviously, diet is included, lifestyle and diet. So maintain a healthy weight. It will again half your problems will be solved. And very important, work smart. The working posture that you have, the ergonomics, especially now in this home offices, is a lot of people have come to me with knee issues because they're sitting on chairs that are not right, sitting with spine issues, shoulder issues. So make sure that your work environment is very ergonomic and don't ignore any warning signs. The body is giving you warning all the time. So the minute you start observing or starting to feel something here and there, don't ignore those signs and let it reach a chronic level that you really need medical intervention. Okay, all these are solvable problems. So the minute you start seeing warning signs, just take charge and start investing in a long-term health rather than temporary. Like Meghna said, don't be reactive, be proactive.
Correct. So there's one question from Rajni Pradeep, where she is asking, is Yoga Nidra a guided session?
So Yoga Nidra, those who have never done, is a guided session. Okay, mostly I would say 90% guided sessions. Either your therapist will do, or there are a lot of good recordings also available. Okay, slowly, once you're an experienced Yoga Nidra practitioner, then you can do self-guided Yoga Nidra. But what happens in Yoga Nidra is you tend to drift away and you tend to fall asleep. So that is why guided sessions, I would say initially you start with till you're very confident that you're able to finish one whole session without falling asleep. But doesn't matter if you're doing guided, it is still excellent for relaxation.
Right. So the next question is from Dr. Fizan Khan, physio. He is asking that my question, back pain, lumbar, L1, L2 problem. So maybe the question says that what should be from a yoga perspective.
Correct. So from what I understood, Dr. Faizan, you are having a lumbar problem in L1 and L2. Okay, so like I said, I'll tell you first what not to do. Okay, not to do forward bends, not to do deep twisting postures. The list of asanas that I gave you, lying down, prone position, all these are especially Tadasana, vertical extension of the spine, side bending, okay, and slight back bending like Sphinx pose and Cobra pose are excellent for L1 and L2 problem. Okay, but before you start doing any deep practices, please check out whether you have any disc herniation or disc bulge, because then that you have to be extra careful that doing these practices is not aggravating the problem.
So the next question is from Hanumant Mane. He is telling spondylitis problem. Yeah. So what would be the yoga therapy perspective for spondylitis?
So see, there are I have a few patients now with spondylitis. What happens in spondylitis is inflammation, right? So you have your range of motion is very limited, and you have severe pain. So any practice that you start has to be very gentle. L1, like I said, level 1 you have to start with. Okay, first you focus on getting a little bit of range of motion. First of all, if you have inflammation and all that, don't do anything. If there's swelling, don't do anything right now. IZ, all those things, so the inflammation goes down. Then you have to start increasing the range of motion and little by little start to strengthen the area. So if it is a cervical spondylitis, okay, you will not be able to bend your head, move anywhere. Okay, what we do in physio is that you may have a neck brace, correct? In yoga therapy, we have a slightly different approach. We start by moving our neck. We don't use any braces. We start by doing 1 degree movement, 2 degree movement, and slowly get that range of motion back. Okay, but again, before you attempt anything on your own, you have to find out what is really the cause of the problem. It may be here something, you may be feeling the pain but the cause might be something else totally.
So now the next question is from Dr. Rohit Ishan. Just want to know how breathing works during yoga exercise. I've seen many people says hold the breath, stretch and release and exhale. So how does this work?
So from
Ishan, Dr. Rohit.
Okay. So breathing plays a very important role, right, in yoga. In any pose, what I have seen, if you also you must have seen in a class, you're doing a pose, you reach a pose, and too much of effort you have put, and then you're holding your breath in that pose. You're completely tight everywhere. That is not yoga, right? Because in yoga, you reach a pose, you should feel comfortable. The main thing is the breathing. Okay, so you reach a pose very slowly. You should be able to breathe comfortably, inhale and exhale, and then again while releasing the pose, keep breathing. The minute you start holding your breath, you're not doing yoga. Okay, you're not aware of your breathing. So from your question, you said that I've seen many people say hold the breath, stretch and release. I would not agree with that. You will reach a pose. For example, you reach this pose, inhale, and then continue breathing in that pose. Don't hold at all. Continue breathing. But there is always a breath associated with movement. So I think that is what this question means. For example, when you lift up your hands, you inhale usually. Okay, then you continue to breathe. Okay, 5 to 3. You're breathing, you're not holding. And then when you're releasing the pose, exhale and release. So maybe what you understood, or the teacher must have meant to say that when you're inhaling, reach the pose, continue to breathe. When you're exhaling, release the pose. So for each movement, there is a breath associated. In Cobra, for example, you inhale and lift up the head and chest. You will not stop breathing. You will continue to breathe. And when you're releasing, exhale and release. So don't hold the breath in any pose. You're breathing in the pose. But when you inhale and exhale, there is a movement associated. So I think that is what I hope I've answered your question.
Right, that's correct. All right. So the next question that we have got is again from Dr. Fizan. So he has two questions on the line. Please, solution neck pain and swelling long time. How can yoga therapy help? About the cupping therapy, right? So cupping, I will take. You can just talk about it.
See, neck pain and swelling since long time. Before I suggest anything, you would want to know what the problem is, right? Sometimes there is a disc thinning, vertebrae in your cervical spine might be pinching some nerve. So there may be many reasons why you're having neck pain. Sometimes it can just be a shoulder problem, and the swelling is all around the neck and shoulder. So before knowing the actual problem, I would not suggest anything. If you know what the condition is, if you can tell me that it is a cervical disc or something, then because I don't want you to attempt something that will further cause damage.
Right. So I would like to answer to this question, Dr. Fiaz. Any kind of condition whenever there is, right? So there is a stages of recovery. Okay, mostly when it comes to musculoskeletal disorder, which are injury based. So even cervical spondylitis starts in a form of injury and then it turns out to be a degenerative change. Now there are inflammatory changes that happens. So any inflammatory problem that we solve from a physiotherapy perspective is first to relieve that inflammation as much as possible. So the first stage is on pain relief, where you use modalities or hot fermentation, cold fermentation, resting, immobilizing to certain extent. But at the same time, we don't want stiffness to develop, and that's why what we usually do is we start with gentle range of motion exercise. As Priya also mentioned, that we say that you do small movements, so that we call it in our terms as gentle range of motion exercise. So that is to maintain some mobility in the spine. Okay, so that is the first step of treatment. Now, swelling, as you are telling, swelling and pain usually is there in the acute stage. So, acute stage, this is what is required to be done. Acute stage usually lasts between 7 days to 15 days. Once the patient has crossed that 7 days, 15 days time frame, and the swelling is kind of reduced, then the patient is required to move on to the next stage where stretching exercises has to be incorporated because the muscles develop certain level of tightness. So that stretching regime has to be continued for some time, and then after some time, then we move on to the strengthening program. Now, the relief part is a place where there are different modalities that exist. So, as you have mentioned, cupping therapy, right? So, cupping therapy is there, kinesiotaping is there, dry needling is there, or as your electrotherapy modalities is there. All of these are tools for you as a therapist or for any other therapist to help patient to relieve from that symptoms. movements. But that doesn't mean every tool has to be used on every patient. It all depends on what level of damage or what level of inflammation is there, what patient is comfortable with. That's why we constantly say whenever it comes to therapy, therapy cannot be generalized. It has to be personalized depending on a patient to patient. So it's ideal that if you are suffering from this, you should definitely take help from a therapist and identify the cause behind it, the severity of symptom behind it, the severity of pathology behind it, and then slowly start working in the recovery process. It's an injury, a kind of injury or it's an inflammation which needs step-by-step process of recovery. I hope that answers your question. And that takes me to the next question, which is from Dennis. She's asking, ma'am, physiotherapy field is good for future or not? Please share idea. Of course, physiotherapy field is amazing for future. I think billions of Indians suffer from pain every single day, right? And they need you. They need you as a physiotherapist or me as a physiotherapist. So, of course, there's a lot of scope. All right, so yeah, that takes me to the next question. Dr. Rohit Ishan is again asking spinal cord injury L4, L5. What exercise can be done when patient is in recovery stage? All right, so if you want to give some.
So, depending on what kind of injury, if it is an accident or a trauma and there is some, a lot of damage, then yoga therapy is not done at that initial stage. It can be used as supportive, so you can do breathing practices, all those things to mainly work with the mind. Okay, I'm talking about when you are in hospital or when you are really in a bad shape, you are not going to do any yoga asana practice, I would say, at that point of time. Now when you're out and you're in the recovery stage, if you are having a lumbar injury, tractions, so all the lengthening, all the traction movements, there are 2 3 other asanas as well. You will work on vertical traction and very very gentle back extensions or very gentle back bends. Okay, but this is again only when doctor has cleared you that you can now start working with movements. Okay, but because I don't know what the injury was, uh, right in the beginning you're not going to do asanas, you're going to only work with other aspects of yoga therapy. And when you start recovering, you're going to work on traction, very slight back bends, very slight side movements, and when the therapist will evaluate and see what can be added slowly, slowly.
Right. So I would like to also add up in this question, Rohit. So whenever there is a spinal cord injury or neurological disorder involved, there again an multidisciplinary approach or combined approach works really well. Because when a patient is going from stage by stage, okay, so when the patient is moving out of ICU room and in the ward, and from ward he's transiting to home, that's when more of therapeutic approach, physiotherapy approach is required, where the focus is on contracture prevention, pressure sore prevention, at the same time activation of movement with the help of passive range of motion exercise, active assisted range of motion exercise. When the patient starts achieving that active movement ability, okay, even though the power is say grade 3 or grade 2, right, that's when slowly the yoga therapy can definitely pitch in. But initial phase where the movements are not present and the muscles are absolutely paralyzed, that's where we as a physio needs to intervene further. Right. So, okay, the next question is from Farjana Akhtar Priya. Upper back pain hota hai, any solution?
So we have to find out what is the reason or what movement is causing the pain in the upper back. Your chest muscles might be weak. There might be a lot of, so then that assessment has to be done. But just from, if you're just asking me in general that I have an upper back pain, if there is no injury, I can just say that you have weak upper back muscles. So you have to work on stretching and strengthening the muscles of the chest, maybe a little bit of the shoulders, upper back. So asanas for that have to be done. Okay, but again, this has to be like Meghna said. Okay, these are all very specific problems. So assessment will be done, but in general, if you do the 10 asanas that I talked about before, the entire spinal cord you're strengthening and the entire back you're strengthening, you will not have any of these. Just work on strengthening the upper back muscles.
राइट एंड फरजाना, मैं आपको एक और एक चीज इसमें बताना चाहूंगी कि जब आपको अपर बैक पेन जैसे आप एक्सप्लेन कर रहे हो होता है ना, तो ये इसका सबसे कॉमन कारण होता है हमारा पोस्चर, मतलब हम किस तरीके से बैठ के काम करते हैं. अक्सर हम लोग को फोन यूज करने की आदत होती है, हम पूरा झुक जाते हैं या लैपटॉप्स पे काम करते हैं, तो हमारा पोस्चर है ना, ये एक सोर्स है ये प्रॉब्लम का. तो अगर आपको इसको पहले तो ठीक करना है, ट्रीटमेंट की बात हम बाद में अगर करते हैं, तो पहले तो हमें अपने पोस्चर को कैसे करेक्ट करना है इस पे ध्यान देना चाहिए। मतलब आप खुद को पहले ऑब्जर्व करो, क्या आपकी टेंडेंसी है बार बार झुकने की, गर्दन को आगे लेके जाने की। अगर ये है तो अपने फोन पे जरूर से एक अलार्म सेट कर दो, जब भी वो अलार्म बजता है अपने आप को प्रेस करके फिर से इरेक्ट पोजीशन पे आ जाओ। अगर आप इस हैबिट, इस आदत को लगा देते हो तो धीरे धीरे भी आपका ये पेन कम हो जाएंगे। Right, so that takes me to the next question, which is again from Rohit. Ma'am, can I give electrotherapy Faraday current to stimulate the nerve? In previous question that I had asked, it's basically a RTA case. There's no power in the muscle. Yes, Faraday current definitely can be given over here. No problem at all. But at the same time, I would suggest you can use PNF technique as well because it's more of facilitation that is required. So that should be combined in your situation. All right, guys. So I think we have covered all the questions both on Instagram as well as on YouTube. Thank you so much for joining. It was a great session. Lots to learn from Priya. So thank you, Priya, for joining.
Thank you, Meghna.
And I hope you guys also like this session. And if yes, please make sure to hit a thumbs up on this video. Okay, one more question has come. Ma'am, मेरी second time Bell's palsy हुआ, symptoms same in neck pain, बहुत ज़्यादा nerve pain हुआ है. फरजाना, ओके, आई आस्क यू, आंसर योर क्वेश्चन. अगर आपको बेल्स पाल्सी की वजह से अगर गर्दन में दर्द होता है ना, तो उसमें कारण ये होता है कि हमारा नेक में एक मसल होता है यहाँ पे जिसको प्लेटिस्मा मसल कहते हैं. ठीक है, ये भी हमारा जो बेल्स पाल्सी में पैरालाइज की वजह से जो नसें लाइक मसल्स जो पैरालाइज हो जाते हैं ना, उसमें का एक मसल होता है. तो ये क्या करता है ना, ये पूरा से खींचते रहता है कंटिन्यूसली, क्योंकि दूसरे मसल्स उसको खींचते हैं. उसकी खुद की ताकत होल्ड करने की रही नहीं है. तो इसीलिए बहुत ज़्यादा ज़रूरी है कि आप रोज रेगुलरली दिन में 2 से 3 बार नेक की एक्सरसाइज कीजिए, जिसमें आप ऊपर देख रहे हो लेकिन हाथों से इसको नीचे स्ट्रेच कर रहे हो. आप अगर ऐसे कर रहे हो तो आप ऑब्जर्व करोगे यहाँ पे आपको स्ट्रेच फील होगा, है ना. तो आप ये प्लेटिस्मा मसल को स्ट्रेचिंग दे रहे हो और फिर रिपीट आ रहे हो. ठीक है, इससे एक फ्लेक्सिबिलिटी बनेगी आपके प्लेटिस्मा मसल में, जिससे आपका दर्द कम हो जाएगा. अगर आपको भी दर्द रहता है तो आपको चेक करना पड़ेगा कि आपका यहाँ पे एक मसल होता है जिसको स्टर्नोक्लिडोमास्टॉइड मसल कहते हैं. हमारे नेक का मसल होता है जिसको ट्रेपेजियस मसल कहते हैं, और ये लोअर ट्रेपेजियस मसल होता है. ये 3 मसल भी ना हमारे पोस्चर में अफेक्ट हो जाते हैं. तो आप इसको रेगुलरली मसाज कर सकते हो. इस मसल्स को मूवमेंट देने के लिए शोल्डर मूवमेंट्स कर सकते हो, गर्दन के मूवमेंट्स कर सकते हो. इसको अगर आप रेगुलरली करेंगे तो आपका नेक पेन डेफिनेटली कम होगा. लेकिन अगर फिर भी नहीं हो रहा है तो अगेन आई वुड सजेस्ट आपको फिजियोथेरेपिस्ट को दिखाना जरूर चाहिए. I hope that answers. Rohit, thank you so much. Okay, most welcome, Rohit. All right, guys, thank you so much for joining in the session. It was great meeting you all after a long time. I will try to come again and again on these live streams so that we can have more interaction. Make sure to put in the comments all your feedbacks, as well as make sure to like this live session so that we also feel motivated to do it again. All right, so thank you so much.
Thank you.
See you. Bye bye.
Take care.
No, your stream is wrong.